All right, so today we have an amazing OT, Milani, with us. She is going to talk about occupational therapy and sensory, kind of give up some basics. And then, at the end, we will have some potential OT referrals available to anyone that wants them. I can send you a list if you would like, if you are interested in getting your child started with OT. But I will let Allie take it away.
Great. Thank you so much, Rachel. All right. So today we're going to be talking about occupational therapy, and we're going to be doing a little basic overview of sensory and everything that comes along with that. So what we're going to start with, we're just going to start with a basic overview of what occupational therapy is, kind of the process of what it looks like to become an OT, and working with the autism community. Would OT be something that's beneficial for your child, for your family? Get a little bit into OT and ABA, and then we'll just go into sensory processing, sensory integration, overview of the sensory system, sensory diets, all that good stuff. And then at the end, I have some additional resources for anybody who's interested in delving a little bit deeper into that sensory world. Okay, so starting with the basics, what is occupational therapy? Occupational therapy really just focuses on helping individuals across the lifespan participate in their desired occupations, which we just kind of categorize as meaningful activities, with the therapeutic use of everyday activities based on the client and their family's personal interests and needs. In pediatric OT specifically, we focus on sensory processing, sensory integration and self-regulation, emotional regulation and coping skills, social and play skills, fine motor, visual motor, and gross motor skills, strengthening and postural control, reflex integration, motor planning and coordination, ADLs and IADLs, executive functioning, and safety awareness. A lot of times, a lot of these things kind of go hand in hand with each other. So if you're struggling with one of them, you might be having difficulty with another, which is why we love to do so many dynamic activities in OT that incorporate so many of these things at once. All right, so to become an OT, at this point in time, you have to have at least a master's degree in OT from an accredited university, except for those OTs who have been practicing for a really long time. When the rules changed for having to get your master's, the people who had their bachelor's degree already were kind of grandfathered into the system. In addition to schooling, OTs have to obtain their national licensure through taking a board exam, and then they also must apply for their state licensure. And to maintain that licensure, we have to complete continuing education courses to stay up to date on the most relevant information to ensure the best possible outcomes for the clients. Some specific areas of specialization that we can really target for this population are sensory integration. You can get an additional certification in that area. That is a huge course where you have to complete 6 modules containing 180 hours of coursework. And you're completing a whole bunch of assignments and exams along with that. And then you apply for your final certification. For autism specific, you can become a certified autism specialist. With that, we're looking for 2 years of experience of working with the ASD population and then 14 hours of training. And that's a credential that has to be renewed every 2 years. I do have a little asterisk at the bottom. A special certification outside of your licensure is not required to work with clients on the autism spectrum. But I always like to say that it's a really good idea if you are seeking out OT services, feel free to ask the clinic if the OT that you're going to be placed with has either taken continuing education courses or has experience working with children on the autism spectrum, because that can certainly be very beneficial for your family moving forward. Okay, so OT and autism. In terms of how we treat kids on the autism spectrum, it really doesn't differ that much from how we would treat any other client. We don't necessarily treat based on the diagnosis. We treat really just based on what they're having difficulty with in their daily life and what you would like to be seeing improved. But just a simple thing that we like to say, The goal of OT when used with clients on the autism spectrum is to improve the individual's overall success in all aspects of life. This is accomplished through teaching and modification of daily life skills, which leads to increased independence. Through the teaching and practice of these skills, along with collaboration with other disciplines, the hope is that the child will eventually be able to independently accomplish such things as focusing on their academic tasks, maintaining reciprocal relationships, engaging in cooperative play, managing self-regulation, expressing their emotions appropriately, and so much more. I mean, if you think back to that first slide where we talked about everything that we do in OT, I feel like it's really just anything that's impactful to your daily life is what we can target and what we can work on. So the big question, would OT be a good fit for my child? Of course, I'm an OT, so I'm going to advocate for the profession. There are so many ways that OT is just so beneficial, especially for kids on the autism spectrum. I really think the biggest piece of that is just our knowledge in sensory processing and sensory integration. As we all know, the autism community is highly impacted in regards to sensory, and it's something that other disciplines don't necessarily know how to fully address just because they don't have the background knowledge and the continuing education that's available to OTs. We have so many courses and specialized trainings that we can do and just hands-on experience with the population. The process for OT, if you were interested in wanting to get started, you would have to get a script from your physician. Most outpatient pediatric clinics are going to require that you have a script. You're going to start with an initial evaluation. In the evaluation, the therapist is going to observe the child, perform some assessments, and receive information from those who are closest to the child, and then analyze that information to develop a treatment plan to specifically work on what is meaningful to the child and the family. For your ongoing treatment, this is where you can kind of discern if the OT is a good fit for your family. I know that was a concern that was brought up of, is this OT a good fit? Is my child making progress? So you're really going to want to look for an OT that is spending additional time building rapport with your kid, with your family, and really addressing those specific needs that are important to you. From there, we go and we find creative and fun, engaging ways to target the skills that are really important and that we're targeting within their treatment plan. And then as treatment progresses, OT should be continually collaborating with the family and caregivers and any other disciplines that the kids are attending, with things like suggestions for carryover, progress updates, any additional concerns that may come up, just so that we can ensure the most positive outcomes. All right, OT and ABA. These two are frequently paired together. And one of the big commonalities that OT and ABA have in place is really just that emphasis on functional independence. While I think the approaches can kind of differ on how we address that area and meet those goals, the end is usually the same. So one huge collaboration point between ABA and OT really lies within discerning sensory needs versus behavioral needs. ABA is fantastic, and I have learned so much from BCBAs, from RBTs, from anyone in the ABA field, really just about how to specifically address behavioral concerns that come up during the session. And as we all know, consistency is key. So if it's only being enforced in ABA and then I'm reinforcing certain behaviors in OT, kids are going to have more difficulty really applying those skills across settings and just in general if there's no consistency. So that's one really big benefit of those two disciplines collaborating. On the flip side of that, OTs, since we do have such a specialized interest in the sensory system and have just valuable information on how to assess sensory needs and how those needs can be appropriately addressed, it's a really great way for us to kind of relay that to the ABA team so that when the kids are in their ABA sessions, then their sensory needs can be met at the same time. OTs also have extensive training on prerequisite skills that may be necessary to master prior to be able to perform a particular task. So for example, if in ABA, your kid is working on tying their shoes, they might be having trouble making progress And what an OT specializes in is those prerequisite skills. So we can kind of backwards chain and look at some of the prerequisite skills that are necessary to complete this task. So for tying shoes, you would need to be able to use your pincer grasp. You would need to be able to use both hands together. You would need to be able to cross your midline. You would need to be able to have the executive functioning skill of sequencing all the steps of shoe tying. And then there's the visual attention. There's just so many skills that go into something as simple as tying a shoe that I think we don't even realize on a daily basis. So that I think is how OTs can kind of provide a little bit of assistance if there is a breakdown occurring with the particular skills that are being targeted. When both disciplines work together, we take a more holistic approach to treatment and provide additional opportunities to generalize the skills that they are learning across environments. Like I said, consistency is key. The more exposure you have to each discipline, the more carryover you're going to see. So moving on to sensory, now that we kind of jumped into that a little bit, I just want to give some sensory disclaimers. I think sensory is a really tricky thing because the system is just so complex and it's always evolving and changing. For as much as we know, there is a ton that we don't know. Sensory is also very personal and highly individualized. The way individuals process and integrate sensory input from their environment changes so frequently, and it's often without any warning or explanation. I can't even tell you how many times I came up with a sensory intervention for a kid that worked beautifully one day. Like they were super regulated, everything looked great. And then later that day, we did the same intervention and it did nothing. It really is just an evidence-based game of trial and error with sensory. We look at what's going on with the kid, try to figure out what sensory input they either need or they're getting too much of. And then we go from there and just try to use strategies to keep them regulated. We definitely understand that figuring out sensory can be a frustrating process. It's frustrating for us, it's frustrating for the kid, it's frustrating for the family. But we're all in this together, and OTs are always willing to problem solve this. And we're more than happy to help you guys through all of this at any time. All right, so some basic sensory definitions. Sensory processing and sensory integration are often used interchangeably, but there are some slight differences between the two of them. When we're talking about sensory processing, we're really talking about a person's ability to process information from their body and from the environment to use for meaningful activities. So this information is coming through the 5 senses, along with your proprioceptive, which is your deep pressure and body awareness, and your vestibular systems, which is your movement. And then the way your brain organizes and interprets this information varies based on the individual. Sensory integration, that's another term that was coined by Jane Ayers about 30 years ago. Sensory integration is a little bit different in the sense that there's a whole theory based around sensory integration that you can kind of rewire a child's brain by doing certain sensory activities with them. But the blanket statement of the definition of sensory integration is so similar to sensory processing. So it's how people use the information provided by all of the sensations coming in within the body and from the external environment. Like I said, with sensory integration, that goes just a little bit deeper, and it now becomes a theory, and it becomes a specialization where you're focusing on 3 systems. You're focusing on the tactile system, the vestibular system, and the proprioceptive system. And by doing all of those activities and creating this rich sensory experience for kids, what you're doing is creating an adaptive response to the sensory input that's coming in that they're having trouble tolerating, or that they're maybe not getting enough of. And with neuroplasticity, with a child's brain being so flexible and with them being able to learn, the theory behind sensory integration is that the more that they're exposed to the activities, the more that they're desensitized, the more that they get this input, that it's eventually going to kind of lessen the severity of the symptoms. Sensory modulation, on the other hand, is the process in which the brain is taking all the various types of sensory input and messages and sorting it out. Simply put, sensory modulation is just how we're responding to the sensory input that's coming in. There are a couple different ways that you can respond. The first of which is over responding. So when you have a low threshold for sensory input, any little bit of input is probably going to go above that threshold, which is going to result in sensitivity or avoidance behaviors because your body is getting too much of that input at that point in time, and you just can't handle it. On the flip side, you can have an under-responsive reaction where this is where you have the high thresholds. So say that I really, really, really need a lot of movement input. I need to run around all day, but I have to sit in my chair all day and pay attention to the teacher. And so I'm just rocking in my chair, I'm wiggling around because I really need that movement input. So that's when I'm going to be seeking out that sensory input. There is such thing as too much sensory. I think Rachel has seen this meme before. It's one of my favorites, but overstimulation can occur when the brain receives more information through the senses than it can process. And that is when sensory overload occurs. In some cases, more than one of your senses might feel overwhelmed at the same time. There are some really common signs of sensory overload. This is just kind of a basic list. If you notice crying and screaming, covering eyes or ears, shutting eyes and refusing to open them, dilated pupils, rapid breathing, clammy, flushed skin, those are generally signs of overstimulation. And at that point, you know that either there is something in the environment that is causing this reaction of overstimulation, or something that's an internal process that's going on that is just too much to handle. In the case of understimulation, kids can be understimulated too. And this is happening when the brain isn't receiving as much sensory input as it requires. So some signs of understimulation are maybe a slumped posture, looking like you're tired, bored, or disinterested, spacing out, or just a general lack of responsiveness. And for this, on the flip side from overstimulation, you're going to want to provide more input to arouse the system and wake it up. We're just going to do a brief overview of the 7 senses. We're going to start with vestibular. So the vestibular system is housed in the inner ear and is responsible for movement and balance. This system is activated by changes in head position. So something as simple as like taking your kid in your arms and then dipping them upside down, that can be a sensory activity that will activate your vestibular system, that will give you movement input. It really is those changes in head position that really gets that system going. Some signs that a child is seeking that input. This would include fidgeting, being unable to sit still, excessively seeking out movement experiences that may or may not be safe. Things like running, jumping, rocking, climbing, all of those. Some signs that a kid might be sensitive to or avoiding vestibular input. One of the big ones is motion sickness. If you get in a car and they're complaining constantly of being nauseous, or maybe they're actually vomiting, that could be a really, really telltale sign of a low threshold for movement input. Kids might dislike being picked up, or like I said, if you're tilting them or their head is moving in a different direction, that could be throwing their vestibular system way off because they might have a very low threshold for it. And then another big one is just fears of movement experiences. All right, next is the proprioceptive system. So the proprioceptive system is housed within muscles, joints, and tendons. This system provides awareness of the body, including body position in relation to self and to the environment. It also provides awareness of force needed to appropriately complete a desired action, such as picking up a paper cup without smashing or dropping it. Signs a kid is seeking proprioceptive input. One of the big ones that I always see is crashing their body. If you see a kid run into a wall, run and jump onto something, that might be a sign that they are seeking that proprioceptive input. Another big one is maybe using too much force when they're completing actions. So like the example with the paper cup, if they're picking something up and you're like, why are you grabbing that so hard? Why did you break that? It might be something that's happening unconsciously because they're not able to modulate that proprioceptive system. Again, seeking out opportunities for deep pressure, like hugging, squeezing, opening and closing doors really hard. poor spatial and body awareness. I personally have a really, really poor proprioceptive system. I run into things all the time. I can't even tell you how many bruises I have on my hips, on my shins, because I just have no awareness of where my body is in space. On the flip side, sensitivity or avoidance to proprioceptive input. So this could look like disliking things that are like a typical amount of pressure. So if you go up and give a kid a hug and they're like, ouch, that really hurt, that could be a sign that maybe their system isn't calibrated for the amounts of pressure that you're giving them that might be typical for somebody else. So that's where we see those increased pain responses as well. The rest are just our 5 senses. So we're going to start with sight, with the visual system. A sign that a child might be seeking out visual input. You're really going to want to look for those kids who are visually inspecting objects. They might be getting down on the ground, looking at things from different angles, watching all of the actions in a room, preferring brightly colored patterns and materials. Anything where they're really getting a lot of visual input coming in is a sign that that's what they need. Signs that a child is sensitive to or avoiding visual input. A lot of times you'll see kids squint if it's bright, closing their eyes. They might become easily visually distracted. They could be sensitive to or avoid bright lights, bright objects, anything like that. Moving on to the auditory system. This system is responsible for your hearing. So signs that a child is seeking auditory input. A big one is that your child might be constantly making all of these funny noises to themselves. Something that sounds funny to you might be super soothing to them. A high-pitched shriek or listening to things at a really loud volume. Those are all signs that your child is seeking that additional auditory input to regulate their system. And then on the other side of that, I really think that the sensitivity to or avoidance of auditory stimulation is one of those really clear-cut things that parents notice right away. If you notice that your child is covering their ears frequently, that they get really upset when loud noises occur, sometimes you'll hear them humming to themselves to drown out the background noise, or you'll notice that they have a lot of difficulty focusing when there is background noise. Those are pretty telltale signs that there's too much noise in the environment for them to be able to handle. Next is the tactile system, and this system is responsible for processing touch information from the body. With this system, signs that your child might be seeking this type of input includes excessively touching items or people. They might not notice when their hands or face are messy or dirty. Touching things that they maybe necessarily shouldn't, just because they're looking for different ways to get input. Enjoying messy play, and then a decreased pain response is also common with kids who seek out tactile input. On the other side of that, sensitivities and avoidance of tactile input presents as being upset when your hands and face are messy. I mean, it might just be like a little drop of glue that got on your finger when you were doing a craft, and that just throws off your entire day because you couldn't tolerate the feel of that on your hands. Difficulty with grooming tasks is another big one. A lot of people come in and say, you know, my kid really hates having their fingernails cut. And is there something that we can do about that? So that is generally an over response from the tactile system that's creating some of those issues. So a lot of times with ADLs, we'll seek to address the tactile system, and with teeth brushing, the oral system, which is next. So we call this the gustatory system, which is really just your sense of taste. Signs that kids are seeking gustatory input. A big one is just that mouthing or eating of inedible items, enjoying strongly flavored crunchy snacks. The biggest telltale sign though is really just that mouthing of items. That's going to occur frequently. You're going to probably have to provide a lot of redirections for safety. That is a sign that kids are really just seeking out that oral input. And then on the other side, signs that a child is sensitive to or avoiding oral input. A lot of this presents as those picky eaters. So they might have a really restricted diet. They might have a really easily triggered gag reflex, dislike teeth brushing, anything involving anything going in their mouth, they're going to probably have an aversive reaction to. And then last but not least, we have the olfactory system. This is your sense of smell. This one I haven't seen as commonly. I've come across a few kids who do seek olfactory input, but this isn't one that we typically address as frequently in OT because it just isn't as present. But there are some signs for seeking olfactory input. This would be smelling non-food items. So I've worked with a kid in the past who every time he would see me, he would run up to me and then he would smell my arm. Everyone thought it was super cute. And I was like, oh no, like he's seeking olfactory input. Like, so we would make little test tubes with different scents in them. And he loved it. And it would be so regulating for him. But yeah, you're going to be attracted to those strong scents like citrus and mint that are going to give you that big burst of input when you're really seeking that out. And then on the flip side, again, if you're sensitive to or avoiding that olfactory input, you might have aversive reactions to typical smells. So maybe, everybody loves the smell of fresh baked cookies, but someone who might have olfactory sensitivities could walk in and their gag reflex could automatically be triggered because it's just too overwhelming for their system. You might also see kids frequently plugging their nose if smells become too intense for them. So sensory diets. The first time that I created a sensory diet, the parent asked me what foods their child should be eating. This is a really common thing that we get. Sensory diets, while you can incorporate food for the oral part of it, it's more of just a schedule of sensory activities. And OTs really, really love to use sensory diets because you're able to use sensory strategies proactively. And this is what really helps to maintain a regulated state throughout the day. We love, love, love facilitating proactive sensory because it's really preferred just for the simple fact that it helps minimize instances of over and under stimulation. So of course, we will create what's called a sensory diet to help facilitate this. And a sensory diet really just targets the individualized areas that your child has difficulty with in regards to sensory processing, and will provide a schedule for those activities based on the thresholds that we've kind of identified from working with them. After we've had a chance to kind of trial some strategies and figure out really what's going on with their sensory system and what's going to be most effective addressing those concerns moving forward. Like I said, sensory diets are just super individualized. So you really are going to be you're going to want to be working with a certified OT just because it's so tricky and it's so complicated. And you really kind of have to delve into that technical sensory world to be able to sufficiently address all of their needs. Sensory strategies can also be used reactively in the case of over and under stimulation to help a child return to that stable functioning state. But the caveat to that is that it's so much more challenging to regulate a child after they become dysregulated, which is why proactive sensory has such a huge emphasis on it, and it's so important. All right, so now that we've learned all about the sensory systems, I'm just going to provide some information on sensory activities. Like I said, sensory activities are always going to be highly individualized, but I can give some basic information that if you want, you can trial at home and see how it works. So for sensory activities, we can complete sensory activities for each of the 7 senses based on what the child needs. However, kind of going back to that sensory integration theory that we talked about earlier, your biggest focus is really going to be on vestibular and proprioceptive activities. You can throw tactile in there too if you want, but typically when you're doing vestibular and proprioceptive, you're getting tactile input at the same time. So generally to maintain regulation, what we like to say is that you're going to complete that vestibular or movement activity first, because that's going to raise the arousal levels. That's going to get the energy up, get the energy out, and then you're going to follow it up with that proprioceptive activity. That's your calm down activity. So that's going to lower those arousal levels and get you ready to attend and just be in a regulated state for your day. Within each of the 7 senses, the sensory activities can either be alerting or calming. So like I was saying before, alerting choices can increase arousal levels and responsiveness, while calming choices are going to decrease arousal levels and responsiveness. When completing sensory, I always love to say this, try your best to promote self-regulation skills. Self-regulation is such an important part of life for people who are impacted by sensory and processing difficulties. If your body's not regulated, it's going to be really, really difficult to attend to anything that you need to do throughout your day. If there's too much noise coming in, if you feel like you need to move, your brain is going to go in this almost like a fight or flight mode where all that's in front of you, all that you can see is, oh, this is crazy. Like I need to fix this right now. I can't focus on doing anything else because I'm just so uncomfortable in my body right now. That's why facilitating self-regulation is just so important, because it's going to be a skill that's needed for their entire life. So the way that I like to do this, especially with our early learners, is to use language to promote awareness of how their body may be feeling. So that first step is really just identifying those physiological cues of, hey, I think you might need a sensory break because your body really looks like it needs to move. You're really wiggly right now. So what can we do? That's when you apply your sensory strategy. So it might be jumping on a trampoline. It might be climbing a rock wall. It might be going on a swing. Any of those are great for getting in movement input. And then, I have animal walks on here too. Animal walks are great because they combine both vestibular and proprioceptive. There's nothing wrong with combining sensory strategies. I think it's actually more beneficial because you're getting both input at once. So it's kind of balancing your body out a little bit more instead of having to do one and the other. But after you kind of complete that sensory activity, you can say, wow, like I love how you did that. And now your body looks nice and calm and you look like you feel so much better. The more you use some of that verbiage and you kind of make the kids aware of, hey, like this is what's going on in my body, maybe next time they can start to identify that themselves and then become more independent with how they can help themselves through those moments and adapt and use those strategies that they need to help themselves feel better. On this slide, I'm not going to read every single thing on here, but I just kind of put some basic suggestions for different types of sensory input based on the senses. So if you're kind of going through this PowerPoint, going through this presentation and thinking, wow, that really sounds like my kid. It really sounds like they seek out a lot of vestibular and tactile input. You can take a look at this chart and you can try out some of those activities. Google is also a really great source. If you just kind of Google different vestibular, different tactile, different proprioceptive, whatever it is, activities, there are lists upon lists that have so many different fun, creative things that you can trial at home. Again, like I mentioned, within each of these sensory systems, those activities can either be alerting or calming. So not going to read through every single one of them again. But you're going to want to be careful with how you are applying these strategies, because if a kid is seeking vestibular input and they seem like they're already really, really amped up and they have those really high arousal levels, you're going to want to focus a little bit more on the calming vestibular. So swinging back and forth on a swing as opposed to spinning, that's going to be a little bit more organizing and a little bit more calming while still giving that movement input that they're seeking. And then the last thing we're going to talk about is creating a sensory space in the home. Again, I don't want to give anything super specific because it's really going to depend on what your child needs and what the individual needs of their sensory system are, and then what the strategies are that are found that are going to be most beneficial for keeping them regulated throughout the day. At the bottom, I just put a couple pictures of sensory spaces. I personally am a huge advocate for those calm rooms. So those two pictures on the left that have the lights, I really think that every single kid can benefit from a low stim room. This just kind of gives the system a chance to cool down, because whether you are seeking that input and you're always kind of at that heightened arousal, or whether input is maybe just too much for you to handle, that room is going to be appropriate. On the other hand, the room that has the swing, that has the rock wall, that's more for our movers and shakers, the ones who really need that movement input, the deep pressure input. That's a great option for those kiddos. I put together some additional resources in case anyone is interested in learning a little bit more about sensory. I really just did kind of a basic overview today, but these are some phenomenal resources. The STAR Institute in particular is just incredible. They have more information than you're going to know what to do with. And then Rachel also put together a wonderful list of pediatric clinics in the area. And like I said, if you feel that your child might benefit from OT services based on some of the information that I presented today, really the best way to address that would be just to see an OT. They can really guide you through a lot of this, help work with your family, and really just get to the bottom of what's going to make your child happy and successful.
Awesome. Chris, do you have any questions that you want to ask?
The question that I have, this is maybe like more specific to my two kiddos. My two kiddos are older. My youngest is almost 18. So I guess I'm having a little bit of a challenge. We do have insurance that would cover occupational therapy for both of them, up until they can, as long as they can stay on our insurance policy. But a lot of clinics and OTs that I'm finding, it's hard to find someone who will cover like older people with autism and provide like that level of service that I still feel they need. So do you have any input for that?
Yeah, unfortunately, I mean, I think it naturally gets a little bit harder as kids get older to find them the services that they need. I personally don't have a lot of experience working with that age group, but I would be more than happy to research some options for those older kids. I know that there are adult day programs where you can go to learn just kind of like some of those life skills that are necessary for living on your own, like career search, job skills, all of those IADLs. So those tasks like managing a checkbook, things like that. Those can be really beneficial. It kind of really depends on what you're looking for within those services though, too.
I guess I'm kind of, for me, my kids are both at a therapeutic day school. At this point, and we'll go, you know, through their 22nd year. I'm looking more for like sensory processing, you know, they're both very sensory, you know, so that's kind of the primary thing.
Okay. Yeah, I can definitely look and see if there's anything out there. I personally haven't, unfortunately, heard of anything that really caters to sensory processing within the older population of pediatrics. Yeah, it's really unfortunate, but I will look into that for you and I can get back to you if I find anything for sure.
Thank you. I appreciate it.
Mm-hmm.
I think one more question I wanted to ask. I think, and I don't know, we don't need to talk about this in great length, but I think something I see a lot in this population is stimming. And so I guess I was wondering if you could just briefly touch on like what stimming is, what it might look like, and like its functions, and like, is it a positive thing? Is it a negative thing? Because I think sometimes parents especially can misunderstand stimming, or you know, don't always like want their kids to do that. Can you touch briefly on that?
Yeah, absolutely. This is something we come across commonly in OT. I definitely understand the parents' perspective of, you know, being a little bit concerned with the stimming behaviors. It does definitely look different. It draws attention. That might be some of the reasons that parents might want to try to minimize some of these behaviors. But I'm going to go a little bit into the functions behind stimming. So stimming is based off of a sensory basis. And as we know, sensory is a physiological need. That's something that kids can't control. People who have sensory processing challenges, they can't control the needs that their body feel. So one of the ways that results and manifests is through stimming. So maybe if your child is seeking auditory input, you might see them going like this and going all day long. That's a stim that I've seen before, a stim that a parent has said, oh my gosh, can you please help me with this? Like they do it all day, they do it all night. And when it's so impactful to the extent that maybe your family is not sleeping all night because your child is just pounding on the wall and making that noise all night, that's when we try to find replacement behaviors for that stim. And that's where that sensory diet comes in. So stimming in itself, I think if it's not impactful to the overall day, I personally don't try to discourage it. Stimming is actually one of the first steps within self-regulation. So that's, I mean, the independence coming with that is your child identifying that, hey, my body really, really needs this input right now. So this is the way that I found to give myself that input that makes me feel good and helps keep me regulated. That's why I never like to discourage stimming unless, like we talked about earlier, it really, really is having a big functional impact on the family or on the kid. If it might be unsafe or something like that, then we'll try to find replacement behaviors through that sensory diet, where you can be giving that proactive input to try to reduce the self-stimulatory behaviors.
Yeah.
Does that make sense?
Yeah, I think that's a great answer. Yeah, I think you're right. I think what I see a lot is it's a great way for kids to help self-regulate. But I think you're right. There's certain times where it either is impacting the family so much, or it's impacting the child's overall success as well. So I think it's good to identify, like, sometimes it's okay, and other times, it's good to find replacement behaviors for it. Yeah. Okay.
Absolutely.
Chris, do you have any more questions?
No, I don't. I thought this was just packed with lots of information. I can already tell you I'm going to be going back and looking it over. I really thought you're going into how OTs know, like, the prerequisite skills and looking at those prerequisite skills and kind of going, backward chaining, like what those are. I thought that was really interesting and really helpful. So I appreciated the detail and the explanations of this. Thank you.
Yeah, of course. I was more than happy to put this together.
Yeah. And I can say, as someone who has worked on a team with other OTs, including Allie, like I'm a social worker, I'm all focused on coping skills and emotional regulation. And I think that just goes so much hand in hand with what OTs do. And I think it's just so helpful and so important for, I'd say, a large majority of our population. And even, like you said, even kids that aren't on the autism spectrum, I think a lot of, other kids can benefit as well. So yeah, I really appreciate it, Allie. Thank you so much. If anyone has any other questions, if they're not on here today, you can email me and I can forward those questions to Allie and hopefully get some answers. But yeah, we really appreciate it. And yeah, thank you so much.
Of course. Thanks so much for having me.
Yeah.
Thank you.